In my office, I see a lot of newborns, and those early years can be important for a conversation that comes up a lot, which is tummy time. I'm Dr. Jen Anaker with Anaker Clinics of Chiropractic. Tummy time is so important, and it should really be started just as soon as you can within those first few days of life, honestly. And you can start in small increments. Small increments might be after a diaper change, that to be able to have your child just lay there for as long as they feel comfortable until they start to give you their cues if they're crying or whimpering. Just a few seconds to maybe a couple minutes, and then by the age of 3 months, we want to see, sometimes you'll see 30 minutes, but we also describe in chiropractic really even more headed towards 60 minutes. Now, why is tummy time important? So important. It leads to be able to help to prevent from a flattened skull, or what's called plagiocephaly. It gives sensory information. It gives motor skills, fine and gross motor skills. It helps to be able to get that child to have their head up, to have a better neck curvature, to strengthen the neck muscles, strengthen the abdominal muscles and the chest muscles. So that way, after the phase of tummy time, your child is ready to get into more crawling and scooting, which then of course leads into walking. This also helps with balance and coordination, to know where your child's at in space and to be able to receive that input and that stimulus of what's going on visually around your child, to be able to help further on down the line with eye and hand coordination. There's just so many reasons why tummy time is so important. Now, tummy time, I will say, if your child is having challenges with tummy time, there can be a few things going on. Sometimes there may be a tongue tie or a lip tie where there's a restraint that's going on in the tissue called the tether oral tissue, where it's hard for a child to put their head up. There might have been in utero restraint or birth trauma, whether it was a quick birth, long birth, cord around the neck. There might be something that on a chiropractic level that we're looking to see if there's any fixations or restrictions that are going on that are not allowing the child to get that head in more of an upright position. And the tummy time should not just be on the stomach just like this. And you might see that at first, but over time, you want to be able to see them lift their head up as well. So if there is a challenge with the tummy time, I would advise, whether it's a chiropractor or another type of provider, be sure to get that looked at again, because as you can hear from all of the benefits of tummy time, that can also lead to challenges with tummy time, but also challenges with things that might go on down the road. Now, ways to do tummy time can vary greatly, depending on where you want to start or what feels comfortable to your child. One of the first ways to start is chest to chest, where the child is looking up at you. That can be a very comforting way to do it. Obviously, you can put them down onto, a table or onto the floor. And it's always really nice when you're having that visual interaction with them, looking them in the eye, chatting with them as they're going along. And a lot of times parents will do this maybe like right after a diaper change, or something that you can put into that repetition of it. But other ways that you can do it is to have the child maybe a little bit over the boppy, or just a rolled towel, something that maybe helps them to be able to give a little bit more stability. Another one is a football hold, or if your arm's out and the child is lying belly down across your arm, and then the head is looking outward towards the hand. That can be a nice way, especially if the child has any reflux or gassiness. That might feel comforting to the child. The other one is if you have an exercise ball, or sometimes it'll be referenced a birthing ball, is that to place the child over the ball, obviously have stability top and bottom, and then just slowly rock back and forth the child, and that'll help to give tummy time. And maybe add just a little light, I'll call it a bounce, but just a really light kind of a pulsating bounce type motion that'll also help out as well. So as you can see, tummy time is very important. Again, by the age of 3 months, shooting for the in totality for the day, which is 60 minutes per day, and your child will benefit not only in those first few months, but also as they continue to grow. If you have any other continued questions about your little one, please let us know. Again, Dr. Jen Anaker.